Loss of appetite are often normal for cats, but it still shouldn't be ignored. If your cat skips the occasional meal but otherwise eats normally, then you ought to watch closely for trends. If your cat stops eating entirely or is merely eating tiny amounts, you would like to urge your veterinarian involved. Lack of eating for even a couple of days can cause a significant problem called liver disease or hepatic lipidosis. Increased appetite can also be a priority, especially if it comes on suddenly in an older cat. Hypothyroidism could also be the reason, but your vet will got to run tests to make certain. Increased appetite shouldn't be ignored, even in younger cats. If nothing else, it can lead to overeating and obesity. Weight changes in cats are always concerning, too, whether it's gain or loss. Either might be a sign of an underlying health problem. Weight loss is more urgent in the short term, whereas weight gain is usually more harmful over time. If you're unsure about your cat's weight, make a vet appointment for a checkup or a minimum of a weight check. Lethargy is a sign of a problem, even if it's subtle. Point 3. Contact your vet if your cat seems to be lying around a lot, sleeping more than usual, or just generally has a low energy level. There is probably something happening together with your cat's health. Increased thirst can mean many things in cats. Most often it means there is a problem with the kidneys or urinary tract. Many owners never even see their cats drink water. So, if you begin noticing your cat near the water dish quite before, it means something. Changes in urination are always important to address. Point 4. They often indicate a urinary tract issue or kidney problem. If you notice a change in frequency or quantity of urine, inappropriate urination, or blood within the urine, schedule a vet appointment. If your cat is straining to urinate and zip is beginning, this could be an emergency, particularly in male cats. Bring your cat to a vet immediately. Changes in breathing like wheezing, rapid breathing, shortness of breath, and raspy breathing should never be ignored. If your cat isn't breathing normally, it's going to be best to travel to an emergency clinic. If the signs are very mild, see your regular veterinarian as soon as possible. Discharge from eyes or nose indicates a possible upper respiratory infection. Point 5. This can make your cat feel ill and stop eating. It may be contagious to other cats in your home. Your vet may recommend medications to assist your cat recover faster. Ear debris or discharge might mean your cat has an ear infection or maybe parasites like ear mites. Waiting to address this may cause the eardrum to become affected. Plus, it is very uncomfortable for your cat. Skin irritation or hair loss could also be a symbol of allergies, external parasites, or another skin condition. It's also likely painful or itchy. Don't let your cat suffer needlessly. Your vet could also be ready to offer treatment options. Increased vocalization may mean your cat is sick, in pain, stressed, or simply bored. It's important to rule out a health issue first before you explore the behavioral side of this issue. Overgrooming could also be behavioral, but it could also mean your cat features a skin issue or is in pain. Point 2. If you notice overgrooming, start with a vet visit to undertake to get to the root of the problem. Personality changes could also be normal once they happen over time, especially as your cat ages. However, if your normally friendly cat is showing aggression, or your happy, confident cat is suddenly acting afraid, there's a requirement to further explore together with your vet. Point 2. If your cat seems confused or disoriented, then it's a good, more urgent situation. Limping and trouble jumping up are signs of an injury or a condition like arthritis. Point 2. Don't assume your cat isn't in pain because he's eating and acting normal otherwise. See your vet. Therefore, the injury or condition are often treated appropriately. Swelling in any area of the body should not be ignored. It may be a wound that has turned into an abscess. It could even be a tumor. Watch the swollen area closely. If it's painful, hot to the touch, or doesn't recover during a day or two, see your vet. Bad breath is a sign of dental problems. Mild halitosis might not be urgent, but it means your cat's teeth should be checked soon. Severe bad breath should be addressed sooner. Also, watch for excessive drooling and bleeding from the mouth. If your cat has an oral infection, it exposes the entire body to the bacteria within the mouth. This could lead to problems with the heart and other organs. Emergency situations and your cat's certain situations may be considered urgent. You shouldn't await a meeting at your vet when your cat is experiencing an emergency. Keep information about after-hours veterinarians handy in case you need to rush to one. If you see the signs of an emergent trauma, examples include falling from a height or being hit by a car, difficulty breathing, gums that are blue, white, or very pale, collapse, unconsciousness or unresponsiveness, seizure 5, dizziness, imbalance, or circling, inability to walk, moderate to profuse bleeding, exposure to a poisonous substance, severe pain, showing signs like crying out loudly and excessively or acting aggressive when touched, body temperature over 104 or under 99, normal is typically 100.5 to 102.5, hasn't eaten properly in 24 hours. 2. If you notice anything your cat does that worries you, it's better to be safe than sorry. You can call your vet or the emergency vet if you need help deciding if something is an emergency. How to prevent illness in cats. Many owners underestimate the importance of routine veterinary care for cats. They may wait several years to bring their cats to the vet for checkups. Worse, they often wait until their cat is sick. It's understandable that folks would want to avoid putting their cats through the strain of a veterinary visit. Some cats become very anxious or maybe aggressive at the vet. Rather than waiting, attempt to find a veterinary practice that's less stressful for your cat. Many feline-friendly practices are out there, some even cat-only practices. Alternatively, you'll consider finding a mobile vet who can come to your home. Many cats do better in a familiar environment. Annual veterinary exams are essential for cats. 6. Senior cats can benefit from biannual checkups and routine lab work. These visits give the vet a chance to look at your cat when he appears healthy. The vet may find minor abnormalities on the exam that indicate a minor problem before your cat gets really sick. Early detection might mean you and your vet can take action before the illness becomes serious. You can also keep your cat as healthy as possible by feeding a healthy diet. A healthy diet can help your cat avoid obesity and a good array of other health issues. Many vets recommend wet diets high in protein and low in carbohydrates. Be sure to use routine parasite prevention as recommended by your vet. 7. This will prevent fleas, intestinal parasites, and other parasites from making your cat sick. Provide a happy, low-stress home for your cat. Keep water available in the least times and many of unpolluted, accessible litter boxes in your home. In smaller homes or multiple cat homes, provide vertical space like cat trees and wall shelves.